Welcome to today's Explainer. Today, we're going to unpack the architecture of high-end recovery. Specifically, we're looking at the treatment model used by Seasons in Malibu, which is a premier addiction and mental health facility. Now, without taking any sides or endorsing their services, we're just going to look strictly at the source material to see exactly how they've structured their approach to treatment and what sets their specific methodology apart.
So, that brings us to a massive, really foundational question. What makes rehab actually work? Okay, let's dive into this, because the answer often lies right at the intersection of clinical excellence and a meticulously designed environment. We're going to explore how those two crucial elements combine to foster real, sustainable recovery for folks who are in crisis.
To figure this out, we'll be looking at 4 key areas today. 1. The Seasons difference. 2. Dual diagnosis and therapy. 3. The healing environment. And 4. The treatment journey.
All right, kicking things off with Section 1, the Seasons difference, focusing on foundational care.
When you're evaluating any treatment center, longevity and credentialing are absolute key indicators of quality, right? Well, Seasons has been operating for 18 years and holds CARF accreditation, which is essentially the highest gold standard seal of approval in rehabilitation. They've also been named one of Newsweek's best addiction treatment centers for 5 years in a row. But what really anchors all this data is their 95% satisfaction rate when clients are asked if they'd recommend the facility to a loved one. That is a massive metric in a field where positive outcomes can be incredibly challenging to achieve.
Now, what's really interesting is the number 65. What does that actually represent? It's a huge differentiator for their program. Clients receive up to 65 one-on-one therapy sessions per month. In a lot of standard facilities, care is heavily weighted toward group therapy because, frankly, it's just far cheaper to deliver. But by offering up to 65 individual sessions, the clinical work here is genuinely tailored to the individual rather than relying on group consensus and shared time.
And those sessions aren't just with anybody. Literally every single primary therapist at Seasons in Malibu holds a doctorate in psychology, while their case managers hold master's-level credentials or higher. This level of educational rigor is absolutely not standard in the field. It ensures that clients are working with highly specialized professionals who are capable of navigating some incredibly complex behavioral and psychological patterns.
Moving right along to Section 2, Dual Diagnosis and Therapy. This is all about treating the whole person.
So, let's talk about dual diagnosis. The definition is pretty straightforward, but it's profound. It means treating addiction and mental health conditions simultaneously, rather than tackling one and then the other. Why is this so absolutely crucial? Because mental health issues like depression, complex trauma, and substance use, they tend to feed each other. If you only treat the substance use, but leave that underlying trauma untouched, you're leaving a major root cause fully active. And that's a very common reason why recovery sometimes fails to hold once a patient leaves a facility.
Addiction treatment versus mental health treatment just shouldn't be a battle for priority. Whether a client comes in primarily for, say, an alcohol use disorder or a mental health issue like PTSD, both fronts receive full clinical attention from day one. Seasons is fully licensed by the state of California to treat both, and they even offer a dedicated standalone mental health program for those who don't have substance issues at all.
But what about the structure of the therapy itself? Another defining feature is their customizable framework. There are no mandatory 12-step programs required here. This anti-cookie-cutter approach is a massive departure from traditional rehab norms. While some people find the 12-step structure genuinely helpful, and they are fully supported in it if they do, others simply do not. Seasons adapts to the patient by offering alternatives like smart recovery or refuge recovery. The treatment is built around evidence-based science and the specific person sitting in the room.
Which brings us to Section 3, the healing environment, or healing by the coast.
Beyond the standard treatment fare, we're looking at holistic amenities like yoga, surfing, equine therapy, acupuncture, massage, and even craniosacral therapy. Now, it's really important to understand that these aren't just luxury add-ons designed to make a brochure look pretty. They are active therapeutic tools. They complement the intensive clinical work by helping clients reconnect with their physical bodies, reduce anxiety, and discover healthy, sustainable ways to actually process daily stress.
And all of this takes place against the stunning backdrop of the Malibu coastline. With ocean views, beach access, and over 3 acres of serene, private grounds, the physical environment itself is actively part of the treatment. Removing a person from their daily triggers gives their nervous system the desperately needed quiet to actually settle down. It creates a safe, comfortable container away from all the chaos where the incredibly hard work of recovery can happen.
Let's move into our final section, Section 4, the treatment journey, mapping out the steps to recovery.
Let's see how all this builds into a complete continuum of care,
The journey is broken down into 3 distinct, highly structured phases. Step 1 is medical detox. Step 2 is residential treatment. And Step 3 is aftercare. For individuals and their families who are so often in a state of crisis, having a comforting, easily understandable roadmap like this is incredibly important.
For most people, recovery begins with medical detox. At Seasons, Detox features 24/7 on-site medical monitoring using protocols customized for the specific substance involved rather than just some generic template. Crucially, because this detox happens directly on campus, clients don't have to suffer through the deeply jarring, emotionally taxing experience of switching facilities or starting completely over with a new clinical team right when they're at their most vulnerable.
Once they're safely detoxed, clients transition into the residential phase, which typically lasts anywhere from 30 to 90 days. In this immersive environment, clients live on-site, fully committing to those 65 individual sessions we talked about earlier. By totally removing the availability of substances and the daily routines that trigger use, clients finally get the uninterrupted space, time, and clinical support necessary to do that deep, foundational psychological work.
But, as any professional will tell you, leaving treatment is often when recovery is at its most fragile. That's exactly why the journey concludes with aftercare, providing up to a full year of continued support and accountability. The clinical relationship doesn't just abruptly stop on discharge day. Instead, the team ensures that all the incredible progress made on the Malibu campus successfully carries over into the complex reality of everyday life back home.
And the results of this comprehensive approach really seem to speak for themselves. Listen to these words, straight from the source material. Now that I've completed the program, I can 100% say it saved my life. That's from Casey, a former client from California. Testimonials like this provide some incredibly powerful human validation and social proof. It's one thing to read about clinical protocols and doctorate-level staff, but it is another entirely to hear the profound, life-saving impact this structured care has on a real person.
Which brings us to a final, vital question. Are you ready for a recovery plan built entirely around you? The core takeaway from today's explainer is that highly personalized, dual diagnosis treatment, supported by intense individual therapy and a truly healing environment, can create an incredibly powerful framework for lasting change. I hope this deep dive into the Seasons in Malibu model has empowered you with a clearer understanding of what top-tier recovery can actually look like. Keep questioning, keep learning, and we'll see you on the next explainer.